Great. So good evening, everyone. Welcome to today's session on Introduction to Chiropractic. And chiropractic has been a very interesting topic since last so many years. And it's the most budding topic for our practitioners. So today we have an expert with us, Dr. Boris Dhas, sir. And he is very experienced, very skilled in whatever things you do, he does. And so let us know more about him. He has a 14 years of experience into the field of naturopathy and yoga. He has worked at National Institute of Naturopathy, Pune from year 2012 to 2020. He also worked at Medical Rehabilitation Center, Gardi, Gulperi, and from year 2021 to 22. And he has also worked at Noble Irikal. I may be misspelling, if sorry for that. Nalam Naturopathy and Yoga Center, Tamil Nadu, from year 2023 to 2025. He is very skilled in chiropractic and manual therapy, in functional rehabilitation medicine, Medigym and habituation approaches. And he's also very good at dry needling techniques, holistic health practices, and patient screening and assessment. So we have a lot of things to learn from him: postural correction approach, fitness consultation, and physical sculpting. And as well as he is also an expert of aerial yoga, which is again a very trending topic and trending practice at presently for the youth. So he is really dedicated and compassionate doctor, and with 14 years of his experience, a strong passion for integrative approach, preventive healthcare. He is skilled in applying his evidence-based medical knowledge alongside the holistic modalities, as yoga therapy, naturopathy, lifestyle counseling, physical medicine into the practice. So with that, I think he is one of the very eminent doctors we have. He has received many doctors. He had received Best Doctor Award 2018 at National Institute of Naturopathy, Pune. He has also received Best Team Leader in 2022 at Gardi Institute Muni Medical Rehabilitation Center, Nagarcoil. So I think with this introduction, there's a lot of things to know from him. So let's not take much time and directly hand over the mic to him for his further guidance on today's topic. Welcome, Dr. Boris. Let's start.
Yes. So, thank you, doctor, for a great introduction. Like, so being into naturopathy and being into National Institute of Naturopathy Center, that is a basic milestone where I started my life. NN has taught me a lot of new things, and say Medigym, I've learned a lot of skilled related hands-on trained skilled approach, which has begin zero to something now. People come with different disorders, say neuromuscular disorders. People come with a lot of pain, aches. People can't sleep with aches. So that is how I try to figure out non-invasive therapy. Such a way, without drugs, without any medication, whatever this lifestyle, physical medicine we say, through that, how to heal natural or to show best result in short time. That is where I pitched my knowledge in chiro, osteopathy, or even fitness, or say physical exercise, yoga therapy, or yoga, whatever. So, and obviously, like the skill, whatever we have, it will go with holistic approach. Always, my good friend Dr. Pradeep M.K. Nair also mentioned the same. Nothing goes in single approach or single therapy. only chiro won't cure or only osteopathy won't cure. The way of, like naturopathy also, we know that we have different scope of therapies, say, like acupuncture, chromotherapy, magnetotherapy, or even massages, nutrition diet therapy. Like, the sometimes some pedi might help 70%, some might help 30%. The combination of therapies will work wonders. So similar way, chiropractic also, maybe patients might get result instant on the day one, say pain scale 10 out of 8 pain people come, they might get pain result and pain relief and all, say post therapy 3, 4 and all they get. Sometimes they may get immediate quick result, they won't get any pain also. That much, magical therapy Cairo does. But that doesn't mean we have completely treated them, cured them. The mechanical strain, how it is happening, or even that nourishment, nutrition, or the like ergonomic, many things counts. So even inflammatory markers to reduce, we need some detox therapies. So it is not only Cairo we follow. Yes, Cairo show magic, but that is what we need to understand. Before I start into Cairo, I want to give you a basic understanding. Now, we see a lot of YouTubes, a lot of Instagram, Facebook, small reels we see. They take some model, paid model, and uh, shows that kypotic in one session or two session, they go up straight. A lot of degenerative joint disorders, like, they show magical result kind of videos. Never see such a videos and jump to Cairo. Cairo does magical result if you learn properly, and that doesn't cure complete, like degenerative disorder cases, kyphotic changes, or even ankylosing spondylosis cases, say like scoliotic conditions more than 45-degree. Such a cases and all, you can so progressive result or pain management result, but it can't be 100% reversed. So our approach is completely clinical approach and evidence based only we teach. That helps for patient and for the system. So we won't say like this will cure you, this will make you completely release from your problem. No, but certain level we can show magical result. That for sure. In my clinical experience, I have shown many people good result. I passed 4, 5 years. I'm going different colleges and teaching students as well. Amongst students, they also have a lot of neck pain, back pain, or like some cases and all degenerative changes has happened for some students. Even they victim immediate result. Uh, I do not. I don't feel like to say the name of the college. In last year, when I went to teach Cairo for one batch, third year and fourth year, Tamil Nadu 11. There, one girl post Cairo demo for her, casually I have done. Post that her asthma issue, asthma breathing or difficulty in breathing got better. From childhood, she was suffering. She can't take good breathing. Post Cairo, she felt really good, amazing. So, a lot of miracle will happen, Cairo, if you align properly. Yeah. With this, I like to start my slide, please. Thank you, doctor. Doctor, should I add or you will move? Yeah. Before this, first lady is there, right? Yeah, next one. Okay, fine. So, history, mostly we know that there are different approaches are there. Like Daniel David Palmer, he is the one founder for chiropractic. He started this system around 1895. And D.D. Palmer consider the body has innate immunity, or whatever in naturopathy principle we say body has it inner recovery power to heal its own. The principle goes hands on hands. Like they also believe body is one. Treat the body as a whole. That is their principle. Chiropractic also helps and aid in reducing soft tissue inflammation, say adhesion formation, like fascia related, skeletal muscular related, a lot of tissue impairment or nerve impairment disorder and all. It helps a lot. So, and not only that, it also makes stability, facilitating movement, impaired function, movement, everything through Cairo and manipulation, we can treat better. Next slide, doctor. Yeah, thanks. So basically, I want naturopathy doctors, your mind should be open. There are a lot of politics happens, exclusively like physio say it is ours. Uh, uh, Ayurveda people say it is theirs. Siddha people they say it's them. Like different concepts or approach they have. Say similar way, Marma therapy, Ayurveda people follow it up. Siddha they follow Varma therapy, and they say it's Siddha, they say it's Ravana therapy. It comes from Lord Shiva. And Ayurveda people says that 600 BC, Acharya uh, Shushruta is a founder, and Hippocrates also he has started this 460 to 355 BC, and he also practiced kind of Cairo or mobilizing technique in manual therapy. And Andrew Taylor still he is a founder of osteopath. Uh, in 1874, he has explored this osteopathy technique in USA. He is also army person, army physician. So almost a lot of people ask me what is the difference between osteopathy and chiropractic. Nothing much difference. Chiropractic they focus more on soft tissue area. Chiropractic go one level ahead. They also focus more into joint subluxation or joint related alignment, misalignment. They focus more. Osteopath nowadays they started focusing more along, I mean, like bone bone setting kind of corrections and all. They also started. But earlier, D.D. Palmer is the one who has done a lot of correction, and he believe in it. Mainly exclusively like vertebrae or spinal vertebrae. He is to address. Next slide, please. Yeah. Chiropractic is mainly they focus more on spine, skeletal muscular system, nervous system. They focus more. It is basically non-surgical, drug-free clinical approach. And initially, we start with day one, their screening assessment. We focus exclusively like their gait we see, their plumb line we see, like body has whether symmetric or asymmetric, post related any issues are there. Body related like palpation we see, which are there are certain landmarks are there on the body. So we check each vertebra, scapula, or say the movement of pelvic tilt if it is there, or Q angle correction. Similar way, like quite a lot many things are there. We'll check through skeletal muscular kind of things and all. Uh, and and also it is like body has different fascias. Fascias are uh, like meridian. If any obstacles or any adhesion or any kind of inflammation or markers, or say any chain, like there are kinetic chain. We say chain is something like uh, each joint or each muscle or each uh, the energy start from feet, they believe. Say your tripod of your feet, ankle, knee, hip, all the way it goes upward. Uh, they have also believe, anterior chain, lateral chain, spiral chain, posterior chain, different chain we have in this. Uh, so like next class I'll explain those chain how it works. Since it's a basic fundamental, I'll give an idea. uh, and and also this is this picture you can see the SA joint also play vital role in stabilizing your body, or any joint, particularly misalignment on your T3 T4 area also can lead to postural imbalance, or say your L4 L5, any obstacles or any kind of imbalance if it is there, that also can lead to break the chain. So they also believe each upper body weight, it has to fall, like cervical weight will fall on C6 C7. Most of the people might get mechanical strain on these area, uh, and some people might happen on ulta upward, like say C1 C2. The initial movement start your neck, major movement start on your rotatory movement, flexion, extension, everything will happens on your C1 and C2. Some people, and load, mechanical load ends on C6 C7. So these mechanical issue might start at the age of 20 plus, and they might have muscle soreness or numbness or later ages, next 5 years, 10 years, 20 years later, that become chronic. And mostly we also might have certain strain. We ignore, we cross every day with that pain, and that leads to nerve impingement or degenerative joint changes, osteoporosis, sorry, exclusively arthritic changes, and many other changes. It leads gradually. To reverse that, prevention is better than cure concept only we work. Similar way, each joint, it has its ideal alignment techniques, or assessment technique that we will learn in future. Yeah, next slide, sir. Yeah. So core principle, uh, in simple, any kind of patients they come, initially, first basic thing what we do is we focus on their spine. CNS will be prime focus initially. Uh, any like misalignment, or any the chain of joint, each segment of vertebra, any misalignment, or you know like particular muscle imbalance, say, we all know that we cut the body into half. Whatever left side muscle we have, bone we have, similar right side we have. Imbalance of particular muscle, say your latissimus muscle imbalance, uh, can lead to frozen shoulder. One of the major culprit is latissimus muscle imbalance. Second, your rotator cuff muscle. So similar way, your rhomboides major, which locate posteriorly, can also lead or pull your vertebrae, excuse like T3, T4, T5 area can be pulled towards opposite side. Similar way, your serratus anterior muscle imbalance also can lead to upper mid back pain or imbalance of your vertebra. Similar way, like sternocleidomastoid mastoid muscle imbalance can lead to neck related pain. So however, we uh, focus on spinal alignment, it influences the nervous function, structural impairment can also lead to spinal related disorders, and it leads to pain. The concept, as I say, body innate ability to heal when mechanical barrier are corrected. And Cairo also, we focus a holistic approach after patient assessment. You can see the Q angle, this person knee. Q angle for men, it is somewhere like 10 to 15. Q angle is quadriceps ankle, angle test. Say this is a hip, this is the angle. It should be, the Q angle should be straight line. So this is a better one. This has gone out of the Q line. So for ladies, it will be like 15 to 20 somewhere. It can be little plus or minus. Anywhere imbalance can lead to knee pain, back pain, or ankle related issues and all. Small example I'm giving. There might be other parameters as well, but this you remember, this will definitely going to help your clinical practice. Next slide, doctor. Yeah. So this is what I have mentioned. Anywhere the fascia, different line, front, back, posterior, each line we have. This is the compartment, how it works. This is the line, how it goes. So anywhere out of the midline, the energy, how it transfer, it works as a tripod. Uh, Everywhere, joint to joint, it works. Somewhere like misalignment on particular area can affect next joint, adjacent joint, or some like that is how it goes upward. Anywhere imbalance on lower limb also can lead to TMJ, temporal mandibular joint dysfunction, or it can be lead to C1, C2 compartment syndromes, or upper cross syndromes or lower cross syndromes. Like quite a lot many syndromes are there. You just refer it, you get to know what I try to say now. Yeah, working such joint to joint, it helps a lot. The next slide, doctor. So you can see this is compartment, this is one another compartment, this is another compartment, this is another compartment. It goes upward and it comes downward. That is how the energy cycle goes. This is what the chain I have mentioned. A body can't function without one chain. Body has to work as a multiple cross chain, multiple front line chain, posterior chain, like that different chain only it will function. So the energy, how it transfer, you can see how it goes upward and downward. So it all start from the feet. So the cranial Cairo also, they focus on this. So each joint does the role. However, the joint has its own, movement of pathway. Say the axis of pathway might be, sagittal plane, longitudinal, and transverse plane. And daily mechanical issue, we are completely into sedentary lifestyle, including doctors like sitting job, mostly consultation. We are also into, we focus more in consultation. Long time we consult people. Therapist also, they have a lot of forward bending job. Doctors, we also have a lot of forward bending job. So what happens here is we focus more on sagittal plane. We also focus less on the transverse plane and longitudinal. And transverse plane, it is happening very less nowadays. That also gradually affecting the joint. So muscle stiffness or tightness or rigidity or spasm muscle or like sprained ligaments or fascia tightness, that also can lead to imbalance on your bony area. So can say if something get affect here, these area can be compressed, these area can be compressed. TMJ, as I said, different area it can be affect. So we also focus mobilizing the each joint or chiro popping or thrust. We make and we release the muscle tension, not only muscle tension, we also address on the bony area. Nerve gliding techniques are there, muscle energy techniques are there. We will see one by one. Next slide, doctor. Yeah. So this is how it goes on to spine, how the energy transfer will happen. If any one vertebra, if it is not mobile, sorry, the mobilization or the mobility is not happening in vertebra, say L5, L4, the energy, however, whatever you lift, move, run, the gravity energy come upward towards your quadriceps or hamstring. It goes upward to the vertebra from down to upward or to the muscle area. Not only that, to stabilize your ligament has to be function a lot. And muscle initial, whichever movement you acquire or whichever movement you want to do from, like horizontal adduction or something lifting up to down, bending forward and getting back, or squatting to up. However, whatever movement you do, without spine stability, nothing works. Without each vertebra, it function individually, your movement is not going to get, it can't be lifted easy, it can't be picked easy. So here the problem, how it happen is your vertebra, the energy might be transferred upward, but a few vertebrae may not be function good enough, due to which repeat strain injury will happen on particular joint and facet joint. Even that also could be the one of the reason of degenerative changes. Early degenerative changes are happening. And Chiro also, they focus more on what they believe is each area of your vertebra carries bilateral nerve pathway, and each vertebra, it also carries your like it carries bilaterally like blood and all, carries through your arteries and all. So blood through arteries. So any compression or any spastic thing or any ligament tightness or muscle tightness, it will also compress your supply of your arteries. It also compress. Due to that, your nourishment, nutrition carries towards multi area of your body, or transport it is affecting. Neuroconductivity is getting affected, so that a delayed healing will happen. Uh, Delayed muscles soreness healing, or inflammation, to heal, it takes time. Your organ, most of the supply C1 to C3, it goes upward to the brain, to the skull. C4, C5, C6, C7 and all, mostly it goes on the arms. And similar way, your thoracic to T1 to T12, it goes mostly like your vital organs. T3, T4, T5 and all, mostly it goes on the lower limb. So now your thoracic region, however, any impairment on or vertebra, early degenerative changes, or muscle spasm, or rigid muscle ligaments, uh, your organ function also get impaired. Due to which diabetic also one of the leading cause of diabetic it is happening. Say cancer, body could not able to understand and it could not able to heal. Lymphatic drainage it is getting affected. In simple lymphatic drainage to be make better way, your uh, posterior sorry lateral muscle and C1 C2 if you release on the neck, your drainage will happen better. Like C1, C2 release of in Cairo, mostly people are getting a healthy sleep, like vagus nerve function, but it helps better. Quite a lot, many things are happening through Cairo and manipulation. So common condition we can address is neck pain, low back pain, spondylosis cases, spondylitis cases, disc bulge cases, headache, cervicogenic related, radiating pain related cases, and sciatica, joint dysfunction like frozen shoulder, adhesive capsulitis cases, and we can show really good result. And I'm not saying like tear and all, complete tear and all surgery, we have to refer to surgery. Otherwise, yes, Cairo will help. Postal imbalance, definitely we can give good result. Sports related injuries, yoga related injuries. I have Medi-Gym here. So we have different kind of players, state level, district level, kabaddi players, shuttle, and many other people, they come. If they get any injury, they come to me. We focus, if it is required, Cairo and all we do for them as well. Muscle imbalance, stiffness, everything we can reverse easily. And chiropractic assessment same patient history, subjective complaints or mechanical issues, postural issues, palpitation, static and motion we focus. Goniometer for documentation purpose we focus. Joint range of movement we see, orthopedic and neurological examination we focus, functional movement screening and all we focus. Next, chiropractic techniques say like there are different approaches are there. I've given few here. Spinal manipulation adjustment we focus, mobilization techniques, each joint, each muscle group, like isolated we focus, compound shoulder joints are like completely compound movement. So we focus in little more different way. In future, we'll see that myofascial releasing technique we focus, trigger point therapy we focus, MET like muscle energy technique we focus, uh, like stretching, muscle rehabilitation also we focus. Lifestyle postal advice also we do post this. Correction of kinetic chain helps a lot of progressive improvement in patient. I've seen in those many decades, uh, like influence entire movement pattern, not just one joint. Only one joint treat and leave. They might get the same complaint in 2 months, 3 months. So they won't appreciate us. They find some other doctors. So they need at least long run good result. So that is how we treat with Cairo. And migraine headache, vertigo, gut related issues, not complete thing, certain things in Cairo also we can help them a lot. Brain fog, mood swing, anxiety, hypersensitivity disorder, ADHD, attention deficit hypersensitivity disorder also, autism, like few areas we can help. Like complete genetic, like chromosome defect cases, we can't, but few cases Cairo has helped a lot. Improve lymphatic drainage, Cairo does. Gut brain barrier connect and all we can do better way. Vagus nerve activation and all we can do in better way through Cairo. Neuromechanical effect like stimulates mechanoreceptors ligaments, quite a lot many things. We will work on it. We'll see in future these areas as well. Degrees, yeah, pain signal and all. I'll show last one video. She is a teacher. In 2 sessions only, she got amazing result. Pain related thing that we'll see next. Proprioception, yeah, we see. Yeah. Proprioception, balance, and other thing through feet we start. It is also helping. Yeah, next, doctor. Biomechanical effect of chiropractic. Yeah, we have mentioned this. This is one of main thing. This you remember. There are different grades of mobilizations are there. Grade 1 to grade 5 is there. Fifth one is chiropractic. That is like high velocity, low amplitude technique. That is popping sound, how we do. Quick, rapid, and we find the barrier. Barrier means nothing. Each joint has its respective range of movement. Say, like shoulder, if it has 0 to 180 degree flexion and extension. Into that flexion and extension, we need to focus the barrier or the high velocity, low amplitude technique we focus. Neck also similar way. Beyond range of movement, we never focus. A lot of people like proper like say barber shop. They also does chiro. Tuck. They make it very fast and rapid, but out of the limitation. That is how most of the people they end up with some complicated issues. Some people people might be here doing wrong chiro has taken their life into paraplegia or like stroke has happened. Or people have completely lost their lower limb because of chiro. Uh, that won't happen in our thing because we focus more on evidence based and we also focus on anatomical limitation. So, and we also check initial assessment. If it is needed, we also see interventions MRA, X-ray, or other thing, how the joint, how the nerve, or like osteophytes, if it is there, how we have to treat, like rheumatoid arthritis cases, that also make a lot of uric acid on the joint, how to mobilize on the each joint, whether we have to focus, what scale we have to focus, what pressure you have to give, what direction you have to pull. Sometimes tooth plane we have to pull, sometimes three plane we have to pull. So like that we have to focus. And uh, yeah, like doctor, can you show the red flag? Uh, I hope we have to finish the in time. Yeah, down, down. Next, next, next. Scope of practice. Yeah, scope of practice. Uh, yeah. So, like scope of practice in India, naturopaths we are eligible to practice, and it is there in our curriculum. Definitely state-wise. You just check it up, and definitely you can practice it up along with massages and all. You can practice, and include naturopathy clinic or hospital, spa, wellness center, gym, therapeutic yoga centers, manual therapy centers, rehabilitation exercise centers, ergonomic lifestyle, uh, domain area also. You can focus on opportunities you are getting more. Uh, Next slide, sir. Yeah. So like commonly you have to focus on these area. Uh, like clinical checklist, commonly people have like high sugar level, diabetic patients, more than 300 and all, try not to do Cairo. People have neurological defects, try to check with the parameters and go next level after learning Cairo. Unexpected weight loss, bladder related issues, cancer, tumor, try not to do, fever, infection, try not to do, and osteoporosis, osteopenia. I do focus osteoporosis, osteopenia, certain level expertise later. It will be easy for you to focus because we are not going to damage any cartilage or any, bone related. Your trust, Cairo, everything will be smooth. Patient we feel very comfortable. You are not going to damage any of their, body area. Next one, sir. So, yeah, this we I have mentioned this now. Yeah, next one. Yeah, chiropractic it's mostly on hands-on skilled therapy. So you have to develop this skill. Uh, very few of us, I believe, very few of us into clinical side naturopathy. I won't say like uh, like like allopathy. We are into consultation. We are into sitting job. Our therapist does major job. Teaching to train therapist also I mean, I got one experience, like 3 months, one therapist worked with me, and post that he started his own after learning certain skill from me. So, like if we are trained good enough, sometime major therapies like Cairo and all, if you do, a patient get amazing result. So, doctors, I request you people to learn this skill, and I'm sure your once your hand is trained, definitely your clinic income will happen better. And you and I love to say this, for assessment in Chennai, physio they charge say 10,000 for assessment, and few Kairos they are charging per sitting 3,000 to 8,000, 10,000 different price they charge. It's 10 minutes to 45 minutes ka session. So Cairo, yeah, amazing result is there, and payment also you get good. Yeah. Uh, like this is a patient. I mean, she is a teacher. Please play, doctor. Sir, sound is not there. Yeah, doctor, I shared you that video in case if you can play.
Sorry, there was a technical glitch. So
Okay.
now it's overcome. You have shared the video?
Yeah, I have shared you the video, sir. WhatsApp.
Just,
Check your WhatsApp, please.
just a second.
Yes, doctor.
Meanwhile, you can just discuss with them. I am
Yeah. So now, if you have any questions, you can ask me. Now, one doctor he has asked me like, Cairo does take 45 minutes. Correct me if I'm wrong. Yeah, it depends. Like some people we might be addressing cervical related. Some people we need to adjust from the ankle joint, leg length. We focus on their muscle level. Sometimes not only adjustment we focus. Along with that, we have to focus muscle energy technique. Sometimes if they have adhesion, you have to release with adhesion. We might go with cupping therapy or soft, you know, active releasing technique. We have sometimes we also focus with dry needling, or like sometimes we focus acupuncture. Uh, Sometimes we have to focus along with this like ultrasound. So similar way, it might take time. Depends. Nothing is like this is a fixed thing. It is customized. It is tailor made. Patient to patient, definitely they won't come with single issues. So after assessment only we get to know. I have treated more than 1 hour plus for chronic conditions, and initially we won't start with Cairo. Manipulation only I'll start. Later, yeah, please play the video, sir.
I came Dr. Boris hospital with a severe pain, headache, migraine, neck pain. Before coming, I had no idea what the treatment would be like. The pain was making my professional life difficult, especially as I work in the teaching field. In the beginning, I was taking medicine to manage the pain. I used painkillers. First, I received non-invasive treatment, including some initial electrotherapy. There was a little bit of temporary relief, but the pain would return quickly when I went back to my work. So the major improvement started on the day I began the Cairo treatment. During the session, I could hear the popping sound in my neck. After just the second section, I felt a significant difference. My pain has reduced a lot. My breathing has improved. Earlier, I used to feel breathless while climbing stairs. That issue is better now. I am now pain free without taking my medication. The healing is happening in the natural way. I have been advised to maintain that diet and do the strengthening exercise at home, which I am following. Overall, I am very happy with the progress I have received. Thank you.
Yeah, and she is also having diabetic. Usually, diabetic people, we won't get result that faster and quicker. So body itself heal slow. So post our session, her diabetic has also reversed, not completely. Certain level it start getting reversed now. So they are happy with that as well.
Okay.
Yeah.
We have a question from Dr. Megha MK.
Yeah.
Sir, have you seen any common mistakes given by naturopathy practitioners to their clients in a yoga session, like knee rotation or something?
Uh, like to be honest, yoga also a lot of things got outdated, exclusively like Sushma Vyayama, like loosening exercise. We see anatomically, shoulder and joint has, circumduction movement, rotatory movement, knee doesn't have. Knee, while sitting only, it does internal rotation, external rotation. Knee internal rotation does, 0 to 20 degree, and external rotation does 0 to somewhere like 40 to 60 degree. But standing and doing knee circumferential movement, it is not going to help. It is working on your hip joint and your ankle joint, not much on your knee. So, yeah, we have to upgrade our knowledge.
Yeah.
So,
I was taking sessions. Yeah. You want to say something? Please go ahead.
sorry to interrupt. So, while giving knee rotation, is there any is it really contraindicated? Will it make any joint pains
No,
after doing the
there
knee
is
rotation?
no, definitely, doctor. There is no contraindicator. See, we all know that knee is completely ligament related area, and deeper it has ACL, PCL, lateral ligament. Mostly ligament. Ligament doesn't stretch a lot. Correct. So no, it's waste of time. Spending both doctor time or therapist time and patient time also waste of time. So, yeah.
Okay. Dr. Boris, we have
And
another
one second,
question.
it won't harm. Doing it is not going to harm. I strongly say don't follow that. Better movements are there. You focus on flexion extension of the move, knee, and yeah, that both movement only it does. Yeah.
Same way
Yes.
for the neck also. When we are giving full round rotation, the patient was feeling very nice after the rotation, but it is also not indicated for the neck, right? So we used to give half rotation, but when we give full rotations, we used to feel so much relaxed. Is it okay to give like that full rotation for the neck also?
Doctor, definitely say say now being a doctor, one area you see patient. People have cervical related issue, pathological changes. Circumduction is not at all advised. Each movement, however, we say in clinical side, we say you don't do even complete movement. Whatever we say, you end here, come to anatomical line. Second, you go with the movement, second line, and come to center. And similar way, hyperextension or flexion and extension and lateral rotation like longitudinal plane. This is the movement. This goes with the muscle area, not the bone. Yeah. So normal healthy people you can give circumduction, no problem. But patient wise, you focus therapeutical approach.
Okay, thank you, sir.
Yeah. And neck also does retraction and protraction of the movement. Many people, for say, you sit like this, put your chin, flexion, say, flex your neck 10 to 20 degree and retract backward. Most of us, we have pain here. C1, C2. That indicates you have certain strain on your atlas and occipital region. You have a certain muscle strain. This also gradually leads to brain fog, or your energy will be dropped out fast. If you treat this in Cairo, your energy level will be better, and most of the signal pass from here, from C1, C2 to brain. Your signals also interrupted because of this. So yeah, like neck movement, retraction also you add on your practice, it helps you a lot. Protraction and retraction. Yeah.
Okay, so I think I have that problem now. Okay, thank you, sir.
Yeah.
Yeah. The next question is from Dr. Madhu. Is there chiropractic for ankylosing spondylitis?
Definitely, yes. See, already fused joint, you can't do anything. Recently, I got one patient. He is a welder. Uh, most of the healthy joint vertebrae, I have to mobilize. And post that few session of mobilization, I've done Cairo. It helped him a lot. It improved his mobility. Uh, like his joint was like this. He was turning like this, but thoracic region, certain area, I can able to do the, thrust that helped him move little more, not from the neck, little more movement on the transverse plane he got. Flexion extension, no. Yeah. If you land, definitely you can help ankylosing spondylosis cases also. But consent signature, you have to take it first. You have to explain how you are going to work, what pattern you are going to work, post therapy, what benefit they get, what range of movement you get. Everything you have to document and you have to explain them properly. Yes, that way it helps.
Great. If any more questions, you can unmute yourself and just share your question.
So, which is the best place to learn chiropractic in South India?
Soon I'm going to launch Chennai, January 16, 17, 18. I'll share with sir. You will get the notice soon.
Okay.
Fine.
Probably sir might call me there. You can come and learn there also.
Sir, can you please share your email ID or uh, mobile number in chat so that those who are interested, they can connect with you?
Sure, doctor.
I could assess that chiropractic is a more on hands-on training, and definitely this introduction should help all of us to understand the basics of the chiropractic. It's not just the popping sound what we hear, but it is beyond that. And but so many things we could learn was, in fact, a small disturbed muscle can lead to a bigger problem. And if disturbed fascia may lead to chronic organ issues. So I was hearing everything, and it was really a wonderful session. The way everything was explained, each and every part of body is very important. Don't think that if you have a problem at one particular zone, it may not affect the other part of the body. Yes, the whole body is connected. It may lead to some major problem. So it is said that to treat any problem at its root and its budding time is the right way to treat it. And I think we have expert Dr. Boris with us. He keeps on conducting his workshops throughout India, and you can connect with him. And definitely in his workshops, in his hands-on training, you can learn more, because I think it's more of practical techniques rather than theoretical aspects. Once you are doing hands-on training, you'll be able to also understand the theory aspect of the chiropractic. That's what I could understand from on the entire session. So I think it's a Sunday evening, and still all of us are sparing time because we all want to grow in our life, and we have to bring a strong community. So I sincerely thank Dr. Boris Das. Being Sunday, it's a family time, and he spent his such a precious time with us, guiding us what is chiropractic, introduction to that, and with such a patience he is teaching wonderful to everyone. I think it will be great to learn under his experience. So whenever he conducts workshops, I will do share in the group so that you can definitely go and join. So it's my sincere appreciation to Dr. Boris for his
Thank you, sir.
session. And I'm really overwhelmed that you gave your precious time for today's session. And I also want to thank all the doctors students who joined today's workshop. I know Sunday evening is more of relaxative time, movie time, Netflix time, chill time. But I think this was the best time we could fit into the workshop. And Dr. Boris, so time also was very important. So the scheduled date we could receive was around this. So we worked on it and we could successfully conduct this session with support of you all. So I really thank you all because you gave us such a precious time and because you want to learn and make your life meaningful. So with that, we end up today's session and more upcoming sessions we'll have about the career guidance. So that you'll be getting the creative very shortly. So thank you one and all. And heartiest thank to Dr. Boris for his precious
Thank
time.
you, sir. Thank you, sir.
Thank you.
Thank you, Enigma. Thank you, sir.